Hey there, class. It's Derek, your instructor of 1101, the Introduction to Psychiatric Rehabilitation course. Uh, what you're going to see in the following presentation is done by the NAMI, the National Alliance for Mental Illness, and the presentation is called In Our Own Voice. Before we get started and before I introduce our guests today, I just wanted to give a brief overview of how this presentation has fit in with the broader course over the years. I used to teach this course in person, and every semester I would contact NAMI, New Jersey, and request a presentation, and they would send me two presenters to the class, and they would come on one of the nights towards the end of the semester and talk about what it was like for them um, being in recovery with a mental illness and the things that helped them and where they're at now. And it was great. And I always found the students really inspired by their stories. Last year, I was asked to convert this course to an asynchronous online course. So the opportunity to have a presentation live with a bunch of students gathered together to hear the presenters was really no longer available to us. So I reached out to NAMI and asked them if we could do a special recording of the presentation. Normally, these are not recorded to show in my online courses here. And I want to give you that background. So this is a very special presentation. Typically, these are done in person, but I have here today Asa and Melissa joining me. Welcome, ladies.
Thank you.
So we're going to get started. I'm going to be kind of coming in once in a while to just kind of ask some questions and kind of move the presentation along. But I know you guys have been doing this a little bit. So I'll start out with you, Asa. If you want to just begin with what happened with you and tell your story, I'd love to hear it.
Sure. So my journey with mental illness started pretty early on, at about the age of 12. I started having auditory and visual hallucinations and was experiencing like deep depressive episodes that were kind of going unrecognized as mental illness. A lot of my pediatricians were just telling my parents, well, it's puberty, this happens, it's pretty normal. And then once the hallucinations and suicidal ideation started, is when my parents knew that I actually needed to go get help. Um, After starting the journey on getting help, it took about 3 different diagnoses to get to where I am now, which is bipolar disorder, ADHD, and also PTSD. Um, Within that, there's been years of, being in and out of school, having to go to alternative schools, um, finally graduating, making it to college, and taking 8 years to get my undergraduate degree. With that, all of my symptoms have kind of ebbed and flowed and kind of morphed over the years. Early on, it was extreme anxiety, fear of other people, crowds. I was kind of selectively mute. And as I've gotten older, the depression has stayed, but it shows up kind of differently. So I'm still able to, work for the most part, take care of myself. I'm not necessarily, stuck in a catatonic state or anything like that. But it's definitely changed and morphed over the years. So my mental illness as a teenager looks vastly different than my mental illness as an adult.
That's actually really interesting because I would have to say the same, like, it definitely changes over the
Yeah.
years. My journey started when I was a junior in high school, and it was only, like, 5 years ago, so still pretty recent, but, mental health was viewed completely differently just 5 years ago. I remember it was still so taboo, like, mine definitely went unnoticed as well, like, my parents didn't realize even though I asked them to go to therapy, but, it definitely took a while and it took, like, for me to try and attempt suicide to actually get the help that I needed, but it all started with me having my first serious relationship with a boyfriend and having all these new friends that I just got, and they all just like, when I told them I started suffering with depression or that I felt like I was anxious and depressed, they all just turned it against me and kind of used it as a talking point or a topic to talk about me in my group chats, to not invite me anymore to like hanging out with them. And my boyfriend at the time was also included in those group chats. So a lot of things mentally for me just didn't seem right. Like I felt worthless and I felt so lost and alone. And then one night I received a hate message from somebody I considered like one of my close friends. And it was just paragraphs on paragraphs and basically explaining why like he thought I was a bad person and like why depression made me worse. So that night I attempted to overdose. I mean, obviously it did not happen. I'm here today, luckily. The next day my school was contacted and I wasn't allowed to go back until I got a psychiatric evaluation. And back then I was diagnosed with major depressive disorder and generalized anxiety. Um, that was really hard to deal with. I think probably being hospitalized was probably one of the hardest things to go through, especially in high school, because it's such a big transition and like you don't know what's going on. I was scared and confused. And it just kind of continued to me developing habits of relying on external validation, relying on men uh, typically, and like making making myself feel like I'm good enough for them and that what I do is like approved by other people, I guess. So that's basically carried on and I got into another toxic relationship, used self-harm instead as a coping mechanism and luckily that ended a couple years ago, but it did take a long time before I realized that I deserved better and I like had this disgusting habit of after getting out of a relationship basically looking for another one right away. And it never gave me proper time to heal until like I recently figured that out. Like only recently have I actually been trying to put myself forward. So it's kind of been my story.
Thank you both for sharing that. It's probably hard sometimes to think back to those times. And what struck me when you were just sharing was the kind of the stigma you felt from your friends. The people that you would think would be there for you, that would understand, some elements of what you were going through, being similar in age and whatnot. And you said it was 5 years ago, but I feel like we 5 years ago did have a pretty good idea of what mental health was. And I feel like, we've come a long way, but at the same time, you see through your story how much work we still have left to do with breaking down these stigmatizing beliefs that people have about those that have, depressive episodes or mental illness of any kinds. So, okay, so that was a little bit about what happened. Next, we're going to shift to the things that have helped. So I'm going to go back to you, Asa. Maybe you could talk a little bit about what's helped you in your recovery journey.
Okay, well, that's probably been outside of, the symptoms, actually figuring out what helps has been the hardest. I've been hospitalized more than a dozen times between 12 and now. And it took me getting to about age 28, 29 before I got with a new psychiatrist who kind of figured out that I have treatment resistant depression and that I needed to, instead of being a perpetual guinea pig for medications, let's do some genetic testing to see what we can eliminate off the bat. And when I got the results back, he says, "Well, we have good news and we have bad news. The good news is we know what you shouldn't have. The bad news is it's pretty much everything that we have to offer." So, I was lucky enough to my family is very, very helpful and very hands-on with, getting me help and connecting me with the right people. So, my sister actually found a doctor um, in New York, which I had to travel quite frequently back from Jersey to New York to go see him. But he was doing some more experimental treatments with ketamine, which is now getting more approval and has been approved in a different form for treatment for depression. And I started with ketamine, and it was life changing. The only thing that was like a downside was, like I was saying earlier, my symptoms change pretty frequently year to year. So on top of the ketamine not working as well as it could have, should have, I started going to get transcranial magnetic stimulation on top of that, and that's been what has, on a clinical level, has kept me kind of at a baseline. And then there is also, I have talk therapy. I have two modalities of therapy that I go to. Um, and then I have very, very strong friendships with other people who also either work in mental health or live with a mental illness. Am very active online, which a lot of my community comes from. So I'm never really, even if I'm depressed and at home, I'm never really alone because I have someone to talk to. Um, what else? I recently started learning Brazilian jiu-jitsu, so that's my activity and exercise portion of how I stay healthy. I also blog and podcast, and that's one of the ways that A, I can tell my story, and B, connect to other people.
For me, the things that helped, actually, I think the first thing that definitely helped in my process to begin was me being hospitalized. The isolation and I guess the programs that they put me through definitely helped. I learned how to properly express my emotions and like share it and not bottle it in. And that definitely was a lot for me because I've never learned how to actually express how I felt. Like I just kept quiet about it all the time. And then through that, I like just developed a bunch of different coping mechanisms. Like when I was anxious, I'd use yoga at night, or when I was depressed and like feeling like I was going to be on the verge of a breakdown, I would just like journal and just try to get my feelings out as much as I could. But similar to you, like my biggest help was definitely like my support system and having a loving family, having great teachers around me to like pick me up when I'm down at school, and having actual friends that stayed by me through my side the entire journey. And I think also just like seeing things like this too, things that we do, like it helps.
Yeah.
It definitely helps a lot, and it like kind of changes your view on how other people see it. And like I'm no longer angry that people view mental health in like a negative way. I'm more of like I just want to teach them and like show them like why mental health isn't bad, like why mental illness isn't a bad thing.
Yeah. What strikes me in hearing both of you share your stories and what has helped for you both is that, you both share sort of a mix of the treatments that are available, some more traditional and some more alternative or experimental treatments designed to decrease the symptoms of the mental illness, to make it a little easier to manage day to day, right? But also, the things, that the structure, the friendships, the things that contribute to the rehabilitation aspect of recovery is another thing we talk a lot in this class about the the roles that we occupy in society and what we value, and those often being the drivers of what can make our recovery amazing. You guys talked about how your mental illness has changed, the symptoms have changed, and it's probably changed as you guys have changed and have have learned the things that have helped. Because AC, you were saying like it takes a while to sometimes figure out those things, because a lot of things that could help, but you really, I think, have to know yourself at a deeper level just to kind of start to figure out what's going to work for you. So, all right, let's focus in on what's next for both of you. I'm really excited to hear this part. So, we talked about things that happened, when it got dark, and then as you kind of pulled out of that, the things that have started to help. But now, as you look to the future, what's next for both of you? We'll start again with Asa.
Um, right now, it's pretty much staying on the status quo for me. I try not to look too far into the future. For me personally, just because of the nature of my illness and how it can shift so quickly, and anything that I'm thinking of as a goal for a long term can completely get washed away. So I usually take what's next as kind of week to week, month to month, instead of looking at it in longer periods of time. So at this point, it's really just maintaining the job that I have that I really, really love, maintaining my podcast and my blog, which I talk about mental health, and keeping in contact with my friends. Particularly, this is the fall season. I tend to kind of isolate. So, working on maintaining connections with all of my support systems, and just hopefully not having to be hospitalized anytime soon or ever again.
For me, what's next is I guess well, I just recently graduated college with a degree in accounting. I'm sorry, I don't know why I can't
Congrats.
speak. Thank you. So now I am just continuing education because I need 150 credits, and I'm also studying for my CPA exam, and just trying to work on myself more and put myself first instead of expensing, like, my own happiness for other people. So I'm gonna basically do the same thing, like, I learned how to practice gratitude recently and how to stay mindful and in the moment, and that's always been a difficult thing for me, so that's awesome that you do that because that's something that I just recently learned, and it feels great and gives you kinda, like, some ease at mind. But I think I'm just gonna focus on myself and try to better myself, for the life that I know I deserve.
Yeah, you absolutely deserve it. Thank you both, for sharing these stories. It's amazing to hear, in some ways how different everyone's journey is, but you can so relate yourselves to one another and like the similar struggles that we deal with. So I had a few questions, if it's okay, if we, yeah. Um, so one thing I wanted to ask sort of you both was about your experiences with hospitalization because it seems like that's one area where you had very different experiences. You were saying you hope you never go back, and you're saying actually was pretty helpful. So maybe we could start with Asa, like, um, whatever you feel like sharing. What did you get out, or what could you maybe have gotten out of hospitalization that you did, and then we could go to Melissa.
Um, I found hospitalization just an added layer of trauma for me. Um, our current mental health care system is very um modeled off of our penitentiary system. So a lot of it feels like I'm being punished for being sick. Um, there's been a lot of times where I'm lucid, I'm just depressed, but nobody believes me when what I'm saying. Or I can tell someone that this medication is one that either doesn't work for me or has terrible side effects, and I'm still either forced to take it or said that I'm non-compliant. Um, it's very much a time where I felt voiceless, and it's one of those things. It's like I do everything that I can to not go into the hospital, and sometimes that means hiding my symptoms from other folks. Thankfully, my therapist is also of the frame of mind like, if I can keep you out of the hospital, that's what I'm going to do. So instead of going to the hospital, maybe we can talk to your parents, and instead of you being by yourself in your apartment, you stay with them instead of having to go to the hospital. It's still not my favorite choice, but much better than going to the hospital. Um, but it's definitely not been something that I've found helpful or positive.
Yeah. How about you, Melissa?
So even though the hospital did help, like similar to Asa, I hated the hospital. I hated the way the nurses took care of us. They definitely did not treat us with enough respect. I felt imprisoned almost because we had bedtimes and like times to wake up, and we had to follow all of their timing and all their rules. Um, but what helped me with it was that my family and I were having some issues kind of, and we used family therapy at the hospital to like learn about each other and like be able to open up. And that's the one of the biggest things that I took back from the hospital experience. And I also used not going back to the hospital as motivation to stay out of the hospital
Yeah.
because that is definitely the scariest thing. And I would not want anybody else to go through that feeling, but sometimes it's necessary.
Yeah. Yeah, absolutely. Um, I'm glad you were able to get something out of it. It seems like it led to a connection to a family therapist. So my next question was about therapists, and what do you kind of work on in therapy these days? Is it things like, are you learning skills? Are they teaching you skills to kind of cope with your illness, or what is it that the therapists do? And you know, how are you able to find, like you said, you gave yours, like, because I find that's like such a big thing that a lot of people ask me is like, I know I need to find a therapist, but I don't even know where to start. So anything you want to share, we'll start with Ace again.
Um, My therapist and I, we work on a lot of um, whatever kind of comes up at the moment. A lot of times now later in life, I'm starting to realize how a lot of things that happen in childhood are still affecting me now. So trying to unravel that thread and figure out what coping mechanisms I can use. A lot of it is just being able to speak to someone who's objective and I know won't either use it against me later or judge me for it. And then there's also the other modality of therapy with a different therapist that's strictly for PTSD. And that's where I get most of my coping skills from, where like there's mindfulness. There are different techniques to use when I'm feeling very anxious or dissociating. Um, so that's been super helpful. And my therapist helped me find that therapist because they're in the same practice together. I found my current therapist through um, a contact at the Mental Health Association, who I've worked with, my mom's worked with since I was an adolescent. So we've maintained those really strong connections with the programs and organizations that have helped me get treatment. And they still do to this day connect me to the right people. And then when other people ask me where can I find a therapist, a counselor, I usually point them to I think it is psychologytoday.com because they have a great list and of counselors and therapists that you can filter on what you need.
Actually going off of that, I also look at that same website. I my very first therapist, I was connected to her through my brother actually. So luckily I was lucky enough to get an in because my brother had already gone there. And then I moved on to like other therapists. It didn't work out. I don't know how I found them. I think my parents found them for me. But my current one, I also went through the list of looking through psychologytoday.com and started to look into the companies that these therapists worked for. And that's where I ended up finding my current therapist. And what we work on is basically me talking out my feelings and just feeling like I'm being heard. Sometimes I just feel like when I talk to people, it just goes in one ear, out the other. So she makes me feel like I'm important and I'm being heard and like my voice matters. And she'll like offer me different books because like now I start getting into reading, like books that have positive impacts on your life. So she'll share those books with me, and they kind of keep me motivated and kind of used as a reminder of like why I'm on this healing process and like how I should be continuing.
Yeah, those are wonderful answers because they really illustrate like the wide array of things that a therapist can do for somebody. Sometimes you need just somebody to listen and just shut up and not judge me, and be there when I'm done to say something helpful. And other times it's more skill based. I appreciate you sharing. Like you have different therapists for different needs in your life, and the one related to PTSD is much more skill based. Like for like in the moment, like I'm having trouble. This is something I can do. And I also appreciate, you were saying you both have said online is one resource, and you've recommended therapists. My wife sees a therapist, and she's recommended her therapist to at least half a dozen people in our area. And she's probably got more work than she could do it, but once you find a good one, it's like they're like
Oh yeah.
gold.
Yeah.
Yeah. Um, I just had to ask a couple questions, Asa, about the therapies, the more non-traditional ones, if you can share, because I know ketamine to be um, like an illegal drug that people can abuse. How what is it like to like? Do you take it every day? Do you take it only for therapy? Like, can you share a little bit
Um,
about that?
Depending on how I'm doing, it will be either every other day or every 3 days. I have a specific dosage that I take. It's administered through a nasal spray that I get compounded at a specific pharmacy. Um, I when I first started taking it, I was like, I don't know why people do this for fun because immediately it's very, very disorienting and, I'm out of it for like an hour or two. Um, I'm more used to it now, so I know, take it at this time. I don't have anything to do until tomorrow, so forth and so on. And it's become part of like an easy medication maintenance routine for me. Um, but initially it was kind of scary because it's technically at that point it wasn't approved, but there was some promising studies on it. So I was kind of desperate at that point, because I could not shake my depression at all.
Yeah. Yeah, that I think that therapies like that, and I know like psilocybin different kinds of mushroom therapies are being experimented on now, and I think there's going to be such an influx of you know new research and new trials and new interventions in that class, because you know antidepressants can't help everybody, and I think that finally people are starting to realize that, doctors and people alike. And then the other one you mentioned was like a transcranial.
Magnetic stimulation.
Yeah, so I'd talked to people in the past that had had like electroconvulsive therapy, but then I've heard that this is like sort of a more safer
Yeah.
sort of evolution of that.
So I have had electroconvulsive therapy, and I hated it so much that I never finished my round of treatment. Um you have to be put under general anesthesia, so you're done for a full day. There nothing else you could do. For me, the anesthesia was very, very painful. It burned going in. Then after, there's the headaches, and then the severe memory loss. I still have large chunks of my memory that I never got back from ECT. Um, TMS, or transcranial magnetic stimulation, it's a in and out type of situation. I'm sitting in a chair, I can read, I can be on my phone. Takes about an hour to do both sides of my brain. It kind of just feels like a light tapping on my skull. It doesn't hurt. I don't have any memory loss. I don't have any downtime. I can drive there and back on my own. And it's just something I do every 2 weeks as maintenance treatment. And it's been one of the I think it's like that the key that put everything together in terms of my treatment regime that has kept me stable for so long.
Yeah. Wow, that's fascinating. I'm glad you could share this knowledge with students, because I think this will be very interesting for them. And then one last question for you, Melissa. You mentioned you just graduated, and I know like things like that. Congratulations, by
Thank
the
you.
way. Um, those kind of times can be difficult, especially if you've developed supports through your school that you may not have access to, or you made friends that you won't be seeing. So how has been navigating that transition for you?
So my biggest, I think the place that as much as I love my house and being with my family, it's hard because that's the place where I went through all of my trauma, and that's the place where, like, I felt depressed the most. So, yeah, being out of school, it's definitely a lot harder. I used to live in an apartment with all my girlfriends that also dealt with different mental illnesses, so, like, everybody had each other's backs all the time. But I do the same thing, and I'm trying to
Mhm.
keep in touch with all of my close supporters and all the great bonds that I've made. But I think that's like it's definitely hard to not see those people every day. And it's definitely a big reminder that, like, I'm an adult. I have to do my own things now. I need to like take care of myself, and I can't let other people take care of me anymore. So it's a transition, but I know after a little bit I'll definitely get the hang of it again.
Yeah,
Yeah.
it sounds like you will. And I know like kind of the presenters that I've talked to in the past have said like doing these presentations really is become therapeutic in a way to
Yeah.
to help others and make an impact and help manage things. So I want to thank you both so much for coming in and sharing your stories. It's going to be a wonderful assignment, for the students to kind of watch this video and think about, things that you guys talked about that they can relate to. And there's going to be sort of a discussion assignment that's going to follow that. So thank you both for coming in.
No
Thank
problem.
you so much.